Welcome back to TV Medic. I'm Chuck, and today we're going to look at a skill that's unique to paramedics and advanced EMTs, starting IVs in a moving ambulance. Have you ever seen a nurse trying to start an IV while the patient's bed is being pushed down a hallway? Probably not. But paramedics and advanced EMTs have to be able to start IVs on the move in critical patients. Most often, inactive stroke patients are victims of severe trauma where limiting scene time is critical. So how do you do it? How do you increase your chances of success? Here are some tips that may work for you. The first is focus. You have to shut out all the distractions like bumpy roads, sirens, smells, distracting injuries, and abrupt truck movements that come with running lights and siren in traffic. Next, focus on finding the best possible vein. Tips on finding the best vein are coming up. Second is confidence. You have to have confidence in your IV skills. If your attitude is, I'm probably going to miss, you're likely to miss as you rationalize all the reasons why the start could go bad. Instead of thinking about how you can fail, mentally rehearse how you are going to succeed. Mentally prepare by visualizing each step of a successful start as you set up your equipment. Third, you have to know your medicine and how to successfully apply that knowledge under pressure. You have to prepare beforehand by getting familiar with the anatomy of the arm and where the large veins are located in the antecubital fossa, in the forearm, or on the dorsum of the hand. Know how to feel for a vein and what they feel like. And you have to handle the fear of missing. In the book Emergency Mind by Dr. Dan Dworkis, he writes, handling your fear and pressing forward anyway is always a better answer than paralysis. His recommendation is that actions become centered on rhythm and flow over raw speed and force. So don't rush even when faced with a critical patient that needs a medication or fluids right now. I always think of the Navy SEAL mantra, slow is smooth and smooth is fast. The basic techniques for starting an IV in a moving ambulance are much the same as a stationary start. But there are a few ways to exaggerate normal IV start techniques that will help as you move down the road. Make sure to maximize vein visualization or location. If you've palpated a good vein and are afraid that you're going to lose your place, if you have to look away to grab some gear, mark that vein. I do it by taking the catheter and press the end of the cap into the skin above the vein. This leaves a nice little bullseye for your stick. Other suggestions? Turn the lights up to their brightest setting. Put the patient's arm lower than stretcher level so gravity can help fill the veins. The blood will pool, helping them pop up. If you have heat packs, you can place them on a cold arm to help dilate the vessels and make them easier to see. If your patient is conscious and you're having trouble finding a vein, ask them where they've had previous successful IV starts. Give that site a good look and feel. There may be poke marks from previous attempts that can help guide you. Ask yourself if the vein you have chosen will be able to hold the gauge needle you selected. This will help prevent a blown start. Next, you have to enhance your own stability. Staying belted in usually isn't an option, so I stabilize my position by kneeling down between the stretcher and the squad bench. And I try to limit tremors or motions in my hand by resting my little finger on the extremity. How do you determine the best time to make the stick? No easy answer here. You could have your partner slow down, wait until you get on a smooth patch of road, or just go for it because you don't know when that next bump or vehicle maneuver is going to come. Unlike the hospital, we can't turn to someone else to start the IV for us. When your patient needs this IV now, it comes down to you. Thanks for watching and remember to respond effectively.